Hi, this is Joyce Polino Crane, News Director at WestfordCAT. I'm here today with Will Courtney. He's the Public and Media Relations Manager at Lowell General Hospital. And we're going to talk a little bit about how COVID is impacting that hospital and a few other topics regarding Lowell General. So let's start, Will, with talking about the number of patients you have who are COVID positive at the hospital.
Sure. Well, thanks for having me, Joyce. Right now, we're experiencing what we think is the front side of the expected surge of patients. The governor said between April 10th and 15th would probably be Massachusetts' window for the surge of patients that other communities are seeing. Certainly you're seeing it in New York. So right now we are at 20 patients in the ICU confirmed positive. I think another 20 or 21 non-ICU confirmed positives. And then we have another 20 of what we call a PUI, or a person under investigation, who we're awaiting tests for that are potentially positive. And many of those patients are intensive care patients too. So I don't want to make it sound like this is good news. Certainly it's not good news for any of these patients, but it's compared to some other communities, so far we're doing okay. You know, I think you're seeing a similar community like Salem, where more than 100 patients are filling their hospital up. You're seeing downtown Boston with Mass General has 220. And so we don't want to be complacent. This is not news to say, well, we flattened the curve, time to get back outside. But, you know, we know more are coming every single day. The level of sickness that we're seeing in those patients is continuing to increase. A lot of these people are very sick. And so we're celebrating those who are discharged. We are seeing a few being discharged now and going home and not intubated and things. But, you know, over the next week or so, we are still prepared with alternative spaces, things like that, for an influx of patients that is something we don't typically see, for sure. Already, you know, all of our operations are really focused on this response. You know, people have probably heard, you know, people in Westford have had procedures delayed, people, you know, elective surgeries, certain non-urgent things like x-rays or exams that we don't think need to happen right this moment. You know, we don't want people coming in and out of our facilities. We want to keep them safe. We want to keep staff safe. And so I walked into the hospital the other day. It's really an eerie place to be in right now. People have been to the Lowell General Hospital. No, it's when you walk in, you've got that big atrium, you've got the Dunkin' Donuts there. There's people milling around. There's a lot of activity. Right now, it's, you know, pretty quiet. The only people allowed in are really people who need to be there. You get handed a mask as soon as you come in. The hallways are quiet and dark. The patient service center, where people are getting tested every day, is empty. And so it's a stark reminder that we are in the middle of a very unique time in our history right now.
Have you had any deaths from COVID-19?
I don't know the exact number we have. It's low. I don't want to guess and say it wrong, but yes, there have been deaths. You know, the patients that we see are not just old, or they're not just the ones with comorbidities, you know, whether it might be immune suppression from a cancer treatment or diabetics. You know, obesity is another thing that seems to factor into how people do this. But, you know, it's worth reminding people that when you look at the statistics of who is being tested positive, you look at each age group from 20 to 30 to 30 to 40, up through 70 to 80 and 80 to 90. The numbers are pretty similar. Now, yes, a 25-year-old healthy person is going to do better on this, most likely, than somebody who has compromising conditions. But you can ask a 30-year-old, you can read about a 30-year-old who got this and recovered, and certainly it's not something anybody wants to have to go through.
I would imagine not. Oh, it's Very concerning. The curve, what do you see happening with that curve?
What so far social distancing and a lot of this isolation that we're all doing is working. It's, we're seeing the number of new cases in Massachusetts go down by quite a bit over the past week. The Boston Globe has some great tracking numbers that are worth people, I really recommend people gather their own information, listen to experts, look at the numbers. We all want to hear certain levels of information. We want to hear when we can go get back out and do our things, but to trust the information that you're seeing from experts, from the Department of Public Health, from the infectious disease experts, but what they're telling us is leading to less people getting this, being tested positive despite the amount of testing we're doing, and that should lead to a decrease in hospitalizations. You're hearing that in New York right now, and so ultimately that's how we do it. We see less cases. Those cases will then take 2 weeks to come through and get better, but as that happens, we're going to start to feel like the burden on the hospital end hopefully will lighten in the next couple of weeks.
I hope so. So you've had employee furloughs. Can you tell us about that?
Absolutely. It's been really one of the hardest things. I mean, but certainly our focus is on these very sick patients and their families. But the furloughs were of 847 employees with Circle Health and Lowell General. These are, we're the largest employer in the region. We have about 3,700 employees total. And so when you put that in perspective, this is over 1 in 5 people has either taken a pay reduction or had their hours completely reduced. The way that they decided to do this is rather than a full 40-hour furlough for all these people, I believe it's 80% have had their hours reduced. So they're still getting a paycheck. I believe they're still eligible for some sort of unemployment assistance. And then about 20% did get their hours fully furloughed. And again, those are people are eligible for employment assistance, which is not a consolation to anyone who is going through it. But, we imposed this for 90 days. We are very hopeful at the end of that 90 days that all of these people will be welcomed back and will be ready to resume normal operations. But for the time being, we were losing, I believe, I think already $20 million through the first phase of this, maybe more, has been.
What, $20 million in total? Like
$20 million loss over the first 2 weeks, I believe, because of the lack of surgeries, the lack of procedures. All that volume is what sort of drives our finances. And without it, many of these people that worked in these places, an elective surgery place where people might be getting a knee surgery or something that isn't life-threatening, but something that's very important to them. Some of those staff had been, especially nurses, clinicians, have been moved into a labor pool to help back up. We're not used to having this many ICU level patients, critical care patients. So you're seeing nurses and orthopedics helping out in the ICU. You're seeing some of these folks who've been repositioned. Many of them have had to change their routines and their schedules. But then there are those others that have sort of been waiting and watching. Maybe their roles were reduced to some level during this, and those were the people that unfortunately have to endure this sacrifice over the next 90 days.
Wow. Boy, oh boy. Just out of curiosity, how many beds does the hospital have?
So on a typical day, I believe we're at 423. That number fluctuates, and it's actually fluctuated in part because of some of the different things we have done in our ICU over the last couple of years. We updated our ICU. The Gill and Maryland Campbell ICU opened about 2 years ago. Our ICUs are literally state of the art. I don't care about Boston or Chicago or West. They were built with patients and families in mind. You know, the old ICU, people were potentially sharing rooms. There's a curtain. They really upgraded these to have windows, family corridors, privacy, orientation for patients. And so they've done a lot of that work. And so we actually added some beds to a second level of ICUs at the main campus, but then we actually had recently shrunk our capacity at Saints because we had moved a lot of those operations over to the main campus, and some of the volumes were driving that. We weren't seeing as many patients at Saints. So, but thankfully, we've been able to then, after we got permission to DPH to decommission some of those beds, because of the state of emergency and because of what's going on right now, we've actually been able to repurpose a lot of that space. Mm-hmm. So we're using some of that space for patients who do not have COVID-related issues, behavioral health people who were coming to our emergency department. We can help now at our Saints campus and keep them safe. We've got a non-COVID related emergency urgent care kind of evaluations going on in an adjacent building at Saints. So our surge capacity is much greater than what our normal ICU capacity would be. And we have literally had to plan for any scenario. So while we struggle to sort of say we've got X amount of beds right now, because that could depend on the day and depending on which level we activate, we are currently in a position that we feel we are ready for this as best we can be. We can't predict the future, but we feel like we have prepared for some worst case scenarios, and hopefully as better news comes through, some of those worst case scenarios, that the odds of those will start to recede.
So you guys must be having budget cuts as well to your own individual departments. Is that right?
Yeah, and I think that, because we're such an economic driver in this region, because we sponsor so many things, because we donate to things, so many of charity golf tournaments, charity fundraisers, they rely on us as part of that funding, and we do community benefit work across the area, and some of those have had to step back and wait, even just buying advertising, things like that we may do, and typically all of those things are sort of on hold as everything gets focused on this response. So if community members are wondering, are we going to be able to donate to their fundraiser this summer and things? We hope so. We're hopeful we can get back to that. It's so important for what we do. We are a community partner, and we want to get back to that, but you may not get the answer you need in the short term, and then we'll have to make some of those choices coming out of this. But again, that is an important part of what we do.
So how can people help?
People have been amazing already. People may have read about the crafty masks, the cloth masks, many of which hundreds have been donated. People at home, if they're curious about that, they can go to our website at lowellgeneral.org. There are some different ways to give. The crafty masks, many of them we brought in, they are a last resort for healthcare workers if we have a huge shortage of masks, and supply chain is hopefully opening up slowly on that. But the ones we don't use, we will donate to other facilities that might be able to make use of them. But other things people are doing are donating food. We had one country club donated a pizza party for our ED workers and our ICU workers. And we remind people too that it's not just the ICU, it's not just the ED, it's really there's so many support staff. You think about the guy, there's still people who need to be changing sheets. There's still people who need to be doing environmental services, cleaning, delivering meals. These folks are essential to our operations too. And so when you think about those things and you think about, gee, we might like to make some cupcakes and things, certainly our frontline healthcare workers in this situation are heroes. They're incredible. But people across the organization are really stepping up like you wouldn't believe. Doctors who are willing to step out of their normal practice and come help. How can we help? Nurses who are coming in every day and sacrificing their families and seeing families, trying to keep them safe. So financial donations too certainly will help at some point. So I do invite people, it's right on our homepage. They say, what can I do to help a healthcare worker? A great example of what people want to do is, this is Easter coming up this weekend. And so tonight there's about 16 cars that are driving up to the main campus. They're going to go to the top floor of the parking garage, and they're going to do what's called a park and pray. They're going to stay in their cars. They're going to maintain good social distancing and safe practices, but they're going to pray for our healthcare workers and our patients. That's the kind of thing that this community does in a crisis. It's pretty amazing.
Well, I'll be there right in spirit with them. That is a beautiful thing to do.
It's amazing. The community, this is just great. The Greater Lowell community is amazing, and so many partners here on a given regular day, partnering on the opioid crisis and so many other things. And so that goodwill just carries over times 10 into a crisis.
It does. We're just about to wrap up, but before we go, is there anything you want Westford residents to know?
Yes, we are first and foremost, we are still here for patients. Don't think that because you sprained your ankle today, but there's COVID-19 out there, that you can't get checked out. I know you've spoken also to one of our urgent care doctors. We have telemedicine. Our urgent cares are taking appointments. They can see you. They're just going to do it in a very safe way. Do not delay treatment because of this situation. It's really important. We're worried that people might think, I can wait, or I don't need to get checked out for this. Certainly if you have, symptoms that are very mild, but use your own judgment and don't be afraid to reach out to your primary care provider first. But then the best thing we can all do is be patient and stay home, social distance, and really think about, you may look around you and not see any sickness. You may not know somebody who's sick, but that shouldn't make you feel overly comfortable, because the nurse who's going into the ICU, who does see those sick patients, who does see the fact that they can't have visitors right now, and imagine that situation of being isolated. You see a nurse behind a mask who you can't see her facial expression, and they're doing everything they can to make these patients comfortable. They're doing incredible work, but you can help them by staying at home, staying safe, and keeping yourself out of the hospital, keeping people near you out of the hospital, so we can treat patients that do need us. And we will get out of this in a few weeks. Hopefully, maybe, life will be different on the other side of this, but we'll all be able to take a breath and sort of see what the next step looks like.
Thank you, Will. Thank you for spending time with us today. I appreciate it so much.
Anytime, Joyce, let's do it again.
Let's do it again. This is Joyce Polino Crane, and you are watching WestfordCAT News.